Ready? I'm Gary Hordesk, MD, board-certified plastic reconstructive surgeon. I want to talk today about the Bellesoma technique. The traditional lifts and reductions require vertical scars extending from the areola down to the inframammary fold. For small breast lifts or reductions, the lipop incision is required. For a larger breast lift or reduction, the lipop incision is extended horizontally in or near the inframammary fold, creating an anchor-shaped incision. Both techniques depend on compressing the breast below the areola to push the breast up. This elevates the areola complex, but often not the center mass of the breast. Increased tension across the vertical incisions can cause the scar to widen or separate. This typically happens at the junctions connecting the vertical scar to the areola or inframammary fold incisions. Also, since the breast skin is weakened due to previous stretch, the freezing does not have the mechanical strength required to prevent recurrent descent. Another disadvantage of the vertical scar is that it is not anatomic, so the scar cannot be connected. When viewing the breast, the areola is seen first and the eye is drawn to the unsightly vertical scar. These concerns are especially voiced by women with darker skin tones, often resulting in refusing traditional surgery and searching for an alternative. The no vertical scar techniques have evolved from Passeau's original operation in 1925. I was trained in the traditional techniques and the no vertical scar techniques at the University of Texas at Houston and MD Anderson Cancer Center. After completing my training, I began my private practice and gradually moved away from the anchor and lollipop techniques to no vertical scar techniques. These techniques are more complicated, and in order to get better results, I began using three-dimensional computer imaging to determine breast volumes. Knowing the breast volume is essential for predicting the amount of tissue to be removed for reduction and determine the post-op breast size. The original no vertical scar techniques were based on preserving the lower half of the breast with the areola, then passing it up under the upper breast. The disadvantage was the creation of medial lateral doggers and lack of upper breast folds from insufficient elevation. Because of these deficiencies, I decided to alter the technique. I preserved the dermis of the lower half of the breast, but rotated it to create a cone with the areola at the apex. The cone has advantages similar to an implant, but without foreign body complications. However, the weight of the cone could result in inferior breast displacement. I modified the technique to include straps within the cone and attach them to the underlying pectoralis major muscle. The muscle provides active lift to maintain an elevated position. The weight of the breast is transferred to the underlying muscle, which reduces or eliminates neck, shoulder, back pain. The cone preserves the major nerves and ducts to the nipple, which maintains nipple sensation and the ability to breastfeed. The result is breast with upper fullness similar to an implant. After a 7-year review, 95% of my patients could go braless. I'm often asked, if this technique is so good, why don't other surgeons use it? I invented the Bellesoma technique, and my integration of the breast to the muscle is passive. Computer hardware is required to determine the physical measurements, and mathematical formulas are used to determine the surgical incision, cone position, strap placement. Has this technique been reviewed? I published this technique in Plastic Reconstructive Surgery Global Open on December 28th of 2017. I presented at the American Society of Aesthetic Plastic Surgeons on 3 occasions. It was presented at a Plastic Surgical Reconstructive meeting in 2024. It was presented internationally in Italy in 2018 and Greece in 2022. It's also presented at the Vegas Cosmetic Surgery meeting. In summary, the Bellesoma advances are, first of all, cosmetic, no vertical scars, upper fullness simple implant, increased cleavage, long-lasting results. Physiologic, nipple sensation is preserved, breastfeeding is preserved, neck, shoulder, back pain is limited, posture is improved. Physiologically, increased self-esteem, patients appear taller or thinner, patients can wear different clothes, patients can go braless. The fear of implants is avoided, and the cone can be used in the future for fat transfer if volume is required. Thank you for your time.